In breaking news, federal and state leaders will hold an emergency meeting on Monday to fix failures in the COVID-19 vaccine rollout. The Prime Minister's asked premiers and chief ministers to schedule meetings twice a week until the crisis subsides. National Cabinet will prioritise urgent solutions to speed up the program, as Scott Morrison admits there is the need for a new approach. He says there are serious challenges we need to overcome caused by patchy international vaccine supplies, changing medical advice and a global environment of need caused by millions of COVID-19 cases and deaths. I have requested that National Cabinet and our health ministers move back to an operational footing to work together closely to tackle head-on the challenges we're all facing with making our vaccination program as good as it can be. We are throwing everything at these issues, uniting the nation to keep the vaccination program safe, to get the rollout right and to be open and transparent about how we are tracking. The move aims to end months of conflict between federal and state governments over missed targets and delays to protect Australians.
Knowing the nation needs a shot of confidence, a former government minister calls for his colleagues to be honest.
I think the lesson out of all of this is that we've just got to be upfront with the Australian people.
That as businesses demand certainty.
We just can't continue to push off forever the re-engagement with the world.
The Chamber of Commerce and Industry urging the federal government to recommit to a vaccine timeline, or at least goals to help employers map the road ahead. It also wants a commitment from state governments not to close internal borders, as phases 1A and 1B of the population, those most at risk, are inoculated against COVID-19.
Once they're vaccinated, that deals with all of the major risks for ICU and hospitals being overrun, which was where we were at the beginning of this crisis.
With the crisis dragging, Labor is sharpening its message.
The Prime Minister says this isn't a race. He's wrong.
It too is calling for targets, fearing the world is passing us by.
We risk now other countries opening up and getting back to work, and Australia still being locked down from the rest of the world and sitting in a GP's clinic waiting to be vaccinated.
The latest official statistics show 56,000 people received a vaccination in the past 24 hours. Our total number of shots now surpassing 1,234,000. Scott Morrison taking to social media, hoping his message would go viral on Facebook.
Rather than set targets that can get knocked about by every to and fro of international supply chains and other disruptions that can occur, we're just getting on with it.
What the government can't avoid is the growing uncertainty around its AstraZeneca vaccine, with a panel of experts concluding a second case of blood clotting is likely linked to its vaccination program. The West Australian woman in her 40s in a stable condition in hospital.
That her progress has been very positive and that she is recovering well.
It's a very rare finding. As I've said before, your chances of winning lotto are much higher.
But again, it just reflects the importance and stresses the importance of having as many vaccine options on the table as possible.
What Australians won't be getting, though, is a Johnson & Johnson jab. Officials reasoning that despite the vaccine only requiring one injection, it's too similar to the AstraZeneca shot we already have.
We have no advice recommending at this point that the government purchase any additional viral vector vaccines. That's not a reflection, that's just simply an observation.
Getting the vaccine program back on track, now the government's main priority. Jonathan Lee, Sky News, Canberra.